This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Monday, April 27th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. British Prime Minister Boris Johnson is back on the job Monday after becoming the first world leader to contract and recover from COVID-19. Johnson spoke outside his Downing Street office Monday, saying that while he understands the impatience and anxiety people are feeling over the coronavirus, relaxing restrictions right now would risk a, quote, new wave of death and disease that would further harm the British economy. Confirmed cases of COVID-19 worldwide are approaching nearly 3 million, and fatalities have exceeded 206,000, according to Johns Hopkins University statistics. More U.S. states are taking steps Monday to lift some of the restrictions meant to prevent the spread of the coronavirus. But health experts are warning against reopening too early. However, many state governors say measures are in place to protect the public's safety. The U.S. has over 980,000 confirmed cases of COVID-19 with at least 55,000 deaths. New York State continues to be hit the hardest, with about 30% of all U.S. cases and deaths. Now to Africa, where 216 health workers from Cuba arrived in South Africa on Saturday, the latest of more than 20 medical brigades it has sent worldwide to combat the coronavirus pandemic. But the White House is urging nations not to accept Cuba's medical missions on charges it exploits its workers, which Havana denies. But the calls are going largely unheeded as overwhelmed healthcare systems are welcoming the help. Nigeria's state governors are asking President Muhammadu Buhari to approve the mandatory use of face masks in public as confirmed coronavirus cases rise, according to Reuters. But the presidency so far is declining to comment. And the Republic of Congo is reporting 200 cases of COVID-19 and 8 deaths since the first case on March 15th, according to Reuters. Meanwhile, the United Nations food chief is warning that while the world fights the coronavirus pandemic, it is also on the brink of a hunger pandemic. The executive director of the World Food Program met with U.S. Secretary of State Mike Pompeo to discuss ways to avert the worst humanitarian crisis since World War II. VOA's diplomatic correspondent Cindy Sain has our story.
Armed conflict and poverty are already forcing millions of people around the world to go to bed hungry every night.
The World Food Program analysis shows also, due to the coronavirus, that an additional 130 million people could be pushed to the brink of starvation by the end of 2020. That's a total of 265 million people.
Humanitarian organizations, such as the Christian group World Relief, are also sounding the alarm. World Relief says the focus is likely to shift from coronavirus health-related concerns to starvation.
When we think just a few steps ahead, the potential impact on economics and food security could be devastating for much of the world, especially in sub-Saharan Africa, East Africa, Southern Africa particularly, where the economic factors are going to be significant, contributing to food insecurity, especially in areas that we don't usually see it in, like urban areas.
World Relief is calling on the U.S. and other countries to take decisive action.
So we, along with other international development agencies, are calling for the U.S. government to appropriate another $12 billion towards international assistance for this crisis.
If the world fails to act, relief experts say more than 30 countries could face famine as remittances from overseas and tourism revenues dry up. Cindy Sain, VOA News.
Amid coronavirus lockdown restrictions, the World Bank is warning sub-Saharan Africa, the world's largest rice importing region, could be heading from a health crisis directly into a food security crisis. Shira Lee reports.
Nigeria's Benue state is known as the food basket of the country, but Mercy Yielase's rice mill is sitting idle. Demand is high across the nation, but she already has mounds of paddy rice that's going nowhere.
I cannot mill because the marketers are not coming. They have stopped coming. When they start to come, I can mill everything here and they will buy.
The UN says millions of people in the region are at risk of not getting the food they need due to the virus disruptions. Although food truck drivers are meant to be exempt from the lockdown restrictions, many are afraid to operate. Trucking logistics firm Kobo 360's co-founder said 30% of its fleet across Nigeria, Kenya, Togo, Ghana and Uganda has stopped working.
There's no clarity around what can move around, or what trucks can move around, or what assets, or what is essential transportation. So you see many of our transporters and truck owners are scared, or because they're scared to go out and have their drivers on the road because they are worried that they're going to get held or detained because there's no clarity.
Some farmers have reported rotting crops as they wait for trucks that never arrive. While domestic crops go to waste, the imports the region relies on have also dried up. Major suppliers, including India, Vietnam and Cambodia, have reduced or even banned rice exports to make sure their countries have enough. The scarcity has driven up prices beyond the reach of some people. Nigeria's government has said it's taking steps to make sure farmers, millers and buyers can operate. For many, like Yielase, help can't come soon enough.
Shira Lee of Reuters with that report. As the worldwide coronavirus pandemic rages on, its disruptions are impacting vaccine campaigns in many parts of the world's least developed countries. In an interview with VOA's correspondent Maria Madiallo, a major vaccine organization says that while it's important to respond to the current outbreak, it's crucial for countries to keep an eye on other immunization efforts.
A recent study by Gavi, a global vaccine alliance, estimates COVID-19 will cause more than 13 million people to miss out on vaccinations against measles, meningitis, polio and yellow fever, among other infectious and often deadly diseases.
Pakistan, we have had to hold back on some programs because of the lockdown and the inability for people to move. A good number of other countries in West Africa, Burkina Faso, Chad, Zimbabwe. So there's a whole list of countries that will be impacted.
But Tabani Maposa, Gavi's managing director of country programs, tells VOA that not all vaccine campaigns have stopped. For example, the Democratic Republic of Congo is continuing its routine immunizations against measles while the country deals with other pathogens.
The reason they chose to go ahead with measles campaign is because they really learned a big lesson with the Ebola, that measles was actually killing more children than Ebola was actually killing people.
Measles outbreaks are currently ongoing in several countries, including DRC, which has recorded more than 300,000 cases and 6,000 deaths, mostly children under the age of 5, according to UNICEF. At a northern DRC hospital, Doctors Without Borders has treated patients in a measles isolation ward.
So here we can see a typical rashes coming from measles. Here in the skin we can see the tigroid appearance, typical of the recovery phase of the measles.
But with COVID-19 spreading across the developing world, it's likely that more immunization programs will be suspended, risking a resurgence of vaccine-preventable diseases, according to health experts.
We will have, in the next 6 months, in the next 1 year, what I would call a bad cohort of children that may not be protected from measles, that may not be protected from pertussis, and other diseases that are really have high morbidity and mortality.
Some wonder whether it's more important to prevent exposure to the coronavirus or to lower the risk of contracting other diseases.
What is important is both. What we need are health workers that are able to deliver that routine immunization. But if those health workers are not protected, from COVID, then there is no routine immunization. But also how we protect the broader population and contain COVID.
Immunization campaigns faced challenges long before COVID-19 emerged.
There is always going to be somebody who's uninformed, but there is also going to be somebody who really does not believe in vaccines. Our role is to speak the truth of vaccines and what they do.
Maposa says communities must understand the enduring benefits of vaccinations even as they battle COVID-19. Mariama Jallo, VOA News.
A few U.S. states are cautiously easing restrictions, opening retail stores and hair salons. More states are slated to reopen their businesses in the coming weeks. Many state officials are feeling the stress the COVID-19 lockdown is placing on their economies and are looking to the federal government for funding in another stimulus package. VOA's Elizabeth Lee explains.
After weeks of being on lockdown, unemployment levels are skyrocketing. Even businesses that remain open are hurting. The U.S. economy is experiencing impacts of historic proportions, says White House senior advisor and economist Kevin Hassett.
This is the biggest negative shock that our economy, I think, has ever seen. We're going to be looking at an unemployment rate that approaches rates that we saw during the Great Depression.
Hassett says 8.7 million jobs were lost in the 2008 financial crisis. Now the U.S. is seeing that many jobs being lost almost every 10 days. States are facing a financial strain, having to provide for growing unemployment benefits and facing a decrease in tax revenue due to closed businesses. Many governors are advocating for Congress to include funding to states in the next stimulus package.
We're on the front lines. We've taken all these actions. We've got to provide these necessary services to help people get back on their feet. It's critical to the rebounding of our economy.
But many Republicans, as well as White House economists, caution taking on more federal debt after already providing well over $2 trillion in stimulus funding.
Yeah, I think that as we go into the next phase of legislation, we need to think about long-run things that we can do to try to get ahead of the curve on debt. So for sure, we need to do still some short-run things, but I think looking at long-run changes that we can make to things to improve the debt situation, that should be something that should be on the table.
Aside from the debate heating up for the next stimulus package, public health experts, as well as governors and lawmakers in some states, say there needs to be more testing before the economy completely reopens.
We need to be able to test people at double the rate so that our meatpacking plants in Minnesota, the food processing plants in Minnesota and in the Midwest are able to reopen. We're going to have trouble with our food supply chain.
We have to have community tracing. We've got to have a plan for isolation for people that do get tested positive for COVID-19 in the future. And as we think about re-engaging sectors of our economy, really analyzing the risk associated with a particular sector, scoring that risk, determining what protocols need to be in place.
State governors and lawmakers in Congress will not only have to balance the health and safety of people with the economy damage done in a continued lockdown, they will also have to navigate the political fight that is looming in Washington as they discuss the next stimulus package in the backdrop of a presidential election just a few months away. Elizabeth Lee, VOA News.
Japan's benchmark Nikkei index gained 521 points or 2.7%, closing at nearly 19 after the Bank of Japan announced it was buying billions of dollars in government bonds and corporate debt. The benchmark indexes in Hong Kong, Sydney, Shanghai, and Seoul also posted significant gains in late afternoon trading. In oil futures trading, U.S. benchmark West Texas Intermediate crude was trading at $14.60 per barrel, a loss of nearly 14%, while Brent crude, the international standard, was trading at $20.31 per barrel, down 5.2%. Oil markets have been struggling since the COVID-19 pandemic took hold, with governments imposed quarantines choking off demand and causing a massive glut of supplies. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, amid the COVID-19 pandemic, racing and breaking records continues, but in a different way. We'll be right back after this short break. Welcome back to Africa 54. Health workers are first responders during the global coronavirus pandemic, but quarantine makes unlikely heroes, from balcony musicians to neighbors delivering each other's groceries. As VOA's Arasha Basadi reports, calming furry animals may be the next heroes the world needs.
Far from their native South American habitat, these alpacas are saving the day for Germans suffering coronavirus-related stress.
A heartfelt welcome to the alpaca farm.
Frank Messing owns a farm in Eltville, Germany. On it live more than 100 alpacas and llamas working as therapy animals. The virus shut down visits back in March, so Messing went digital.
Man, we had no guests and no revenue. Putting our heads together isn't exactly our thing. So we developed a platform with a digital company where people can book our animals for video calls.
Messing says the animals radiate calm, making them popular with therapy groups.
If you look Joanne in the eyes, you become calmer. Stress isn't the order of the day, and that comes through in video calls. Calm down. Just relax a bit.
Messing's video conferencing IT manager, Stefan Nachtstein, says the new normal of online everything brought this idea to life.
My friend's daughter is taking classes and language lessons online, so we said the alpaca farm could also work. We called Frank. He was into the idea, so we got it up.
Online meetings and dinners have been reality since quarantines began. With farms like Messing's, animal therapy now joins that list. Arash Arabasadi, VOA News, Washington.
Freedom of the press is under attack in many parts of the world, while in others at least incremental freedom gains have been accomplished. Sub-Saharan Africa's situation reflects both trends, with conditions improving in some of its nations but becoming more oppressive in others. And now the coronavirus is presenting a fresh set of challenges to journalists. VOA senior analyst Jeffrey Young spoke with the Committee to Protect Journalists, representative for Sub-Saharan Africa Mudoki Mumo in Nairobi, who details the region's varied conditions for those who report the news.
Mudoki Mumo is the Sub-Saharan Africa representative for the Committee to Protect Journalists. In the last year, can you give me an encapsulated idea as to where in Sub-Saharan Africa journalist freedoms have improved and where they have gotten worse?
Unfortunately, it's a bit of a complicated answer to that question, because it's difficult to say there's one country where we're seeing an overall improvement and another country where we're seeing an overall deterioration of press freedom. Instead, what we're seeing is some indicators changing. So, for instance, we're seeing countries where we noted some journalists who are imprisoned last year, as at December, for example, having freed those journalists. Just by my latest count, I found that we had seen journalists who were in prison in December 2019 being free in at least 7 countries. But while that indicator might indicate is showing an improvement, we're seeing these countries also, again, detaining new journalists. Now, in other countries, we're seeing, when we look at other indicators like the law or where the judiciary stands, an example that I might give of this sort of contrast is Tanzania, where we saw the courts come out and say a really repressive media law was not in keeping with Tanzania's regional commitments to good governance. But then, so that we might consider to be an improvement. But then at the same time, we see a country where journalists, again, are still being arrested, where where the government itself is not complying with court orders to change laws that are problematic. So I'm sorry to say it's sort of a mixed bag. We see some indicators getting better, but we see also regression in other places.
What has been the situation for journalists in the Horn of Africa, better or worse?
It's getting worse, unfortunately. We're seeing countries cracking down on journalists and freedom of expression at this time when they're also trying to control the spread of COVID-19. So we're seeing existing laws being used. So for instance, false news laws to arrest journalists in Somalia who tried to report on COVID-19. Similarly, in Ethiopia, we recently had a journalist who was arrested allegedly for publishing false news and is now being charged under Ethiopia's disinformation law. At the same time, the worst jailer of journalists is in this region. The worst jailer of journalists in sub-Saharan Africa is in this region, that's Eritrea. And Eritrea retains at least 16 journalists behind bars, as far as we can tell this year. Of course, this is incredibly worrying for us.
What about West Africa? Let's look at that now. Are there any countries where journalist freedom have improved, or are there countries in West Africa where things have gotten worse?
Recently, we reported on the assault of journalists in Ghana and in Liberia. We're also concerned about restrictions in Nigeria and how these might affect journalists' ability to cover COVID-19 well. And further beyond that, we've also had pre-existing concerns about the use of laws to warrantless search laws, and also the use of cybercrime laws in Nigeria against journalists.
Let's look farther down the continent. What do we see in the Great Lakes region, in DRC, in that part of Africa? What's going on with journalists there?
We're seeing in this region that there's a crackdown on the press that is associated with political calendars that we already had. So for example, in Uganda and Burundi, upcoming elections have meant that security personnel have really cracked down on the press. Journalists have been harassed, assaulted while trying to report on the opposition. Media houses in Uganda have been shut down when they tried to have opposition leaders come in. And in Burundi, this is particularly a worrying year. We have 4 journalists who remain in jail. And on top of that, we're seeing the government trying to restrict which journalists can access information about COVID-19. Of course, all of this is a bad omen with the elections coming up, and we're really quite concerned about the ability of journalists to cover that election freely and safely. We're seeing a trend where there's sort of a conflation of official information with truth. So when you see journalists coming in and trying to report maybe, or trying to put out information that perhaps hasn't been officially declared as the official truth, then we see a crackdown against them, or where they try to report critically on what's going on.
Thank you very much for joining us on The Voice of America.
Thank you very much, Mr. Young.
That was VOA senior analyst Jeffrey Young speaking with the Committee to Protect Journalists representative for Sub-Saharan Africa, Mudoki Mumo, in Nairobi. In sports news, the cancellation of marathons and major races because of the COVID-19 lockdown measures doesn't mean sport lovers can't compete. Racing and breaking record is still possible. It's just a bit more complicated. Maxim Moskalkov explains.
Despite the strict quarantine measures, people who love sports and running have found a unique way to compete. There are still races to be run, but it's just more of a solitary exercise, sometimes in a runner's backyard. Online races are becoming increasingly popular, and there are a number of platforms that allow runners to register. Run Sign Up is one of them.
A lot of races either turn themselves into virtual races or put out new events that are virtual right now, much more so than normal. And I think that the reason that's happening is that people are looking for ways to stay active, and they're looking for communities and a way to bring people together.
Virtual races are not new. They allow participants to cover a certain distance at a convenient time and place, and then share the results. Their progress can be tracked with a special app connected to GPS. After they finish, they send their results to the race organizers, who announce winners and send out medals and gifts. Porter Breton has been organizing races in Washington state for over 12 years. When races and marathons were cancelled because of the coronavirus pandemic, he decided to transform everything into the online space. That's how his charity organization called the Social Distance Run came to be.
For this race that we just closed registration for last night, we did a fundraiser for the Global Giving Coronavirus Relief Fund. So the total donation, which I just made this morning, was $18,400 for the Global Giving. So that's one purpose. One other thing we're doing is that we're taking some of the proceeds from the race and we're using them to do some grants for small businesses. So the runners are able to nominate a small business that they think needs some help.
Among the runners and sportsmen who didn't want to give up their passion is Michael Wardian. He won the Quarantine Backyard Ultra and was the fastest among 2,300 runners from 65 countries. The Arlington, Virginia resident ran 2.5 days straight and covered 422 kilometers, virtually circling around his house.
I have had the opportunity to, I think, run almost 500 races from, 1 mile to, 400 kilometers across the Gobi Desert, carrying all your stuff on your back, to races across the Sahara Desert in Africa, to marathons in the North Pole and Antarctica. And I'd say probably, incredible events was this backyard ultra that I did about 50 feet from my house.
But not all sportsmen are seasoned professionals. A non-profit organization called Healthy Kids Running Series organizes online races for younger runners from 2 to 14 years old.
And we attract kids that maybe are lacking some self-confidence or self-esteem or maybe a little overweight. And this program allows them to run their race and really experience success.
Online app developers say that multi-day races are gaining more popularity lately, and that no matter how people felt about sports before the pandemic, it's definitely becoming the new craze now. Maxim Moskalkov for VOA News, Washington.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.